more opportunities out there for them to succeed or to participate. Um, there's also the the medical route where sometimes clients may need to be referred to a psychologist or psychiatrist or medical doctor to be prescribed certain medications. That's not my first choice, but I would not leave that option off of the table.
Okay, so do you recommend a sensory therapy for the adults? And do you think it is good, the sensory therapy as a good option for, the psychiatric patients, uh, the depression and anxiety? Could this be an option?
Could you repeat that? You were breaking up. I'm sorry. Could you repeat that one more time?
All right. So I was talking about, the sensory therapy, the sensory intervention, which we
Hmm.
mainly do with people with sensory processing disorder and ASD.
Hmm.
Could the sensory intervention be used with the psychiatric patient, with the patients with depression and anxiety?
Yes, I think it can be successfully used with them. Um, let's take, if we're doing sensory integration with them, what I find very, very effective is stimulating the client's olfactory system or the sense of smell. Because actually, through our studies, we know that the sense of smell is that's the only sense that is directly correlated with the brain, goes straight to the brain when you smell. So I found that aromatherapy um, is very beneficial for depression. Um, also, uh, exposing the client to um, virtual reality, putting them in different environments in tandem with the aromatherapy. Um, Actually, I've used with some adults, I've used with some war veterans and those with PTSD, and it really calms them down and allows them to focus more. So I do believe integrating sensory integration into their particular protocol in order to deal with their depression is very beneficial, but I haven't used that much on as far as dealing with depression. This has been with the adult population. I have not done that with any pediatric population as of yet, but I do find it effective in adults.
All right. Uh, so let's talk about how this, global pandemic has affected the way therapies are being conducted. Because in most part of the world now, the teletherapy is being conducted. So we saw that initially there was resistance from the parent side, from the caregiver side, but slowly they began to accept it. So the question here is that this should this be the new normal after all of this is over? Should we be considering teletherapy as an option more often? Or do you think that this is not as effective, as in-person therapy, and this option should also be used in, this kind of situations when you have no other option, or the teletherapy could become normal now?
Um, some people may get upset with me about this answer. So my particular opinion is I would rather be in the clinic with you or be in your home. I think being in person is is more effective um, because via teletherapy, if you're working with me and we're working on a handwriting task, it's hard for me, even you looking at me right now. If I was writing something, you can't see my hand, you can't see the position of my shoulder. It's hard for you to tell if I'm uh, using my uh, proximal musculature to move the pencil, or am I using my fine motor or interosseous musculature to perform the writing task. There's a lot of things that I think we as OTs we need to kind of put our eyes on. It's teletherapy is beneficial for certain aspects of occupational therapy, but in the long run, I would rather be in front of my clients. However, teletherapy is an option that can be productive. Um, but again, I still prefer to be in person, and I'd rather be in person and take the uh, proper precautions, say PPE and things that would allow me to either come to your home or for you to come to the clinic. That's my preference. Mhm.
All right, that's very well. Okay, so what would you suggest to the occupational therapist, to be more productive? Do you think that occupational therapists should be switching their areas of work? Do you think they should be switching from pediatrics to geriatrics? Or do you think that they should choose one line and continue with that? And how do you suggest them, to improve their productivity, through literatures or being creative, giving time, how they should be doing it, because I'm sure that many therapists sometimes get exhausted, sometimes it is nerve wracking for them, in the tiring, the difficult situation, or maybe with the difficult clients, especially in a pediatrics. So how to keep yourself motivated?
Um, well, the way I keep myself motivated is I continue to learn. Um, I think sometimes therapists may take that initial knowledge that they bring from college or graduating from the university and they let it span throughout their career. And as their career expands and they continue to use that knowledge, the world is changing, the world is evolving. So the occupational therapist has to evolve with it. I think that not evolving as the world evolves can bring about exhaustion because the methods that you were using is not as effective as when you initially learned them because they were brand new then. So you have to continue to learn and be able to implement the new concepts in occupational therapy. You have to be able to understand new and rising technologies that we use for visual perceptual skills or stroke rehabilitation. Um, and I think this also makes you a better therapist. And being a better therapist, taking on this new knowledge helps you avoid that exhaustion. I think the exhaustion comes about when when you're not being as effective. Um, in regards to productivity, I found that being it would be a common thought to think that, well, since I'm doing teletherapy now, I don't have to go into the clinic. I don't have to go into a school building or to a teacher's class. I can do everything from home. I should be really productive. But for me um, and my employees, it was the opposite. Whereas when you're seeing a child in a school setting, you can see from you can see a group of children, and for that group of children you can bill for that time. You see them for that time. You're supposed to see them say 30 minutes per week. You can bring in three children and they all have similar goals. You all can work on an activity together. Whereas now that you're virtual, now that one set of 30 minutes that you would see all three kids, now you have 30 minutes, 30 minutes, 30 minutes. Now that 30-minute block of time is now an hour and a half. And my employees and myself was initially frustrated with this because um, we're we're taking a lot more time to complete our regular OT daily task. Um, so to get around that, we we schedule with the parents exact times when we're going to meet with our kids because one of the issues we were running into was, well, this parent is, we want to start them at 9 o'clock. However, they didn't get onto the Zoom call until 9:17. But now we got another patient scheduled at 9:30. And so to, again, avoid exhaustion and frustration and increase your productivity, just have a clear understanding with the clients of your expectations of them and when they're supposed to participate. You alluded to changing areas of practice. I think one good thing about occupational therapy is that you can change your practice area. And as you probably know, geriatrics looks nothing like ergonomics. Ergonomics looks nothing like pediatrics. Pediatrics looks nothing like uh, neurological treatments in a hospital. So that's the good thing about occupational therapy, where you can, if you're exhausted or you kind of burned out in one area, you can totally switch to something else, and it's like a whole new job, a whole new life for you, because now you're not dealing with the 3-year-old, you're dealing with the adults with neurological deficits, and it's a totally different world. Um, However, you can take that in a good or bad way, because I also look at it as, if I practice in pediatrics for 5 years, I practice in geriatrics for 7 years, I practice in ergonomics for 3 years, am I ever really becoming an expert in any area? So I look at it like that as well. So I see two sides uh, to that scenario, both good and bad.
All right. So, Dr. Frederick Covington, thank you so much for your precious time. It has been a very healthy conversation. And I once again really appreciate your time. And thank you so much for everything on my behalf and on behalf of the viewers.
Well, I thank you for having me. It has been a pleasure.